Hello everyone. Welcome to Wise Age Meaning, where we explore the important aspects of living healthy and meaningful lives as we age. I'm your host for today, and I want to talk about a topic that, honestly, not everyone is comfortable discussing: masturbation in older age. But relax, because here at Wise Age Meaning, we believe sexual health is a natural part of life, no matter how old you are. Today, we're going to talk about 7 common mistakes people make when it comes to masturbation in their later years, and more importantly, how to avoid them so you can take better care of yourself. This isn't a boring lecture, it's a candid conversation, just like I'm sitting down with you for a coffee. Ready? Let's dive in. Part 1. Hygiene and masturbation. First, let's talk about hygiene. When I think about self-care, keeping things clean is always the first thing that comes to mind. But as we age, sometimes we forget this basic step. I'm not saying you don't shower, but as our immune system weakens, even a small lapse in hygiene, like not washing your hands or not cleaning your toys, can lead to infections. In the US, doctors often remind us that the genital area is sensitive, especially as we get older. So be sure to wash your hands and clean the genital area with mild soap before and after. If you use sex toys, which are very common here, brands like Lilo or WeVibe provide clear cleaning instructions. Keeping hygiene up is the first step in loving your body. Don't you think? Part 2. The importance of lubrication. Now, let's talk about something that many people think they don't need: lubrication. As we age, our body produces less natural lubrication than before. Not using lubrication can cause friction, discomfort, or even pain. In the US, you can easily find lubricants in stores like Walgreens or CVS. Try KY Jelly or Astroglide. They're safe and effective. A little bit goes a long way, but don't forget to test it on your skin first to avoid irritation. Using lubricant doesn't just make everything more comfortable. It also boosts your confidence. Who doesn't want to feel comfortable, right? Part 3. Overcoming shame. Now I want to address something a bit tricky: shame. I've heard many people say, masturbating at this age? That's embarrassing. I get it, because society sometimes makes us think it's something wrong. But did you know that in the US, experts like Dr. Ruth Westheimer have completely shifted the way we think about this? They say masturbation is a natural way to love yourself. Whether you're 20 or 80, if you feel embarrassed, try reading a book or listening to a podcast about sexual health. There are many free resources available, like AARP. Once you realize it's completely normal, you'll feel a lot lighter. I always say, living authentically is the smartest way to live. How do you feel about that? Part 4. Listening to your body. Next, let's talk about listening to your body. As we age, our bodies aren't as flexible as they used to be. Some days our joints crack, or we just want to relax. But when it comes to masturbation, many people push themselves too hard, leading to pain or discomfort. Listen to your body. If a position feels uncomfortable, try another. If it hurts, stop right away. Physical therapists in the US always say, your body knows what it needs. You just have to listen. This applies to both sports and our intimate lives. Do you agree? Part 5. Choosing safe products. Another mistake is using unsafe products. Today, sex toys are more accessible, and many are specifically designed for older adults. But buying cheap, unbranded products can lead to irritation or even harm. Choose products from reputable brands like WeVibe or Lilo. Opt for medical-grade silicone, and always read the instructions carefully. I once heard a friend say, investing in your sexual health is like buying a good bed. It's worth every penny. I completely agree. What do you think about choosing quality products? Part 6. Overall health and its impact on intimacy. Have you ever thought about how your overall health impacts intimacy? Diabetes, arthritis, or even blood pressure medication can reduce libido or make masturbation more difficult. But many people don't talk to their doctors about these issues. Be open with your doctor. In the US, they are very open about sexual health. They can suggest changes in medications or recommend exercises to help. I always think, if you're brave enough to check on your heart, talking about sexual health should be just as easy. Have you ever had a conversation with your doctor about your sexual health? Part 7. Educating yourself. Finally, never forget to educate yourself. Many people don't realize that masturbation can reduce the risk of prostate cancer in men or help women maintain pelvic health. There are many free resources available, from reputable organizations like Mayo Clinic, AARP, or online forums. Just spend a few minutes reading an article or watching a video, like this one from Wise Age Meaning. Knowledge helps you feel more confident and enjoy life more. I always say, at this age, we never stop learning. Don't you agree? Conclusion. So, we've covered the 7 most common mistakes people make when it comes to masturbation in older age. From maintaining hygiene, using lubrication, to being open with yourself and choosing safe products, all these things can help you live a healthier and happier life. At Wise Age Meaning, we want you to know that age isn't a limitation. It's an opportunity to live smarter. What do you think about these mistakes? Is there anything you'd like to share or something we should talk more about? Leave a comment and subscribe to Wise Age Meaning so you don't miss the next video. Thank you for spending time with me today. Take care of yourself, and I'll see you next time.